still have folks on the phone?
Yep.
LaFrance here.
Pete's here.
So I heard LaFrance, I heard Peterson, I heard Presverdia.
Kennedy. Ken Davidson here.
Kennedy,
Sorry,
Davidson. All right.
Howard's here.
Howard's here. Thank you. Mr. Peterson, you've asked for the floor.
Thank you, Mr. Chairman. May I have a point of personal privilege, please?
You may have the floor.
Thank you. I move to introduce and take up immediately an emergency ordinance of the Anchorage Municipal Assembly regarding public health and safety measures for the COVID-19 pandemic. Thank you, Mr. Chairman.
Second.
This emergency ordinance is now before us. Emergency ordinance, the Anchorage Municipal Assembly regarding public health and safety measures for the COVID-19 pandemic. Mr. Peterson, would you like to speak to it?
Yes, Mr. Chairman, thank you. Anchorage is still in a public health crisis as hundreds of more people have become infected with the virus this past week. Alaska still has the highest rate in the nation of cases per 100,000 population. This masking ordinance will help bring those numbers down and preserve community health and save lives. All our hospitals are still operating in crisis standards of care here in Anchorage. The rationing of care puts our doctors in an extremely difficult position of deciding who might benefit more from acute care. In some situations, those decisions may cost someone their life. The positivity rate of the virus is over 12, and that means that not enough testing is being done. We need to ensure that enough testing sites are open and the hours of operations are not reduced so people know their status, and if they need to notify others that they might have been in close contact with. We have heard from over 200 people in person and over the phone and have received over 3,000 emailed testimonies. Those testimonies have been critical in improving our original ordinance. We now have an ordinance that takes into account the public input. For example, we have removed entirely the section that had neighbor reporting neighbor. Masks are the simplest and cheapest way to help keep our schools and businesses open so that we can continue to rebuild our economy. More than 10 studies have been cited by the CDC that have confirmed benefits from universal masking that prevent community spread. We need to act now. A prolonged COVID spike will damage our economy. Now, our economy did improve this summer because of the high vaccination rate that Alaska had early on, and also because of Anchorage's low cases earlier this spring. We even had a couple days where we had 0 new cases. We received national news coverage of this, and it helped us get many additional travelers to come here this summer. But now our surge of new positives and the hospital's rationing of care has been on primetime broadcast news and on the front page of major print news. That could cause many to choose to not vacation here next year and take our tourist sector of the economy back to 2020 levels. We need to get this under control as soon as possible to enable our economy to be rebuilt. Another important reason to enact this now is that we'll help our hospitals and our healthcare workers. This will give them hope that we are working to provide relief for the overwhelmed facilities and workforce. After 18 months on the front lines of this battle against the pandemic, this will provide a little light at the end of the tunnel for the workers who are doing all they can to save lives. Thank you, Mr. Chairman.
Right. Mrs. Allard.
Thank you, Chair. I appreciate this. I just wanted to remind the body again that we are second in the nation for COVID testing. And I also wanted to be able to call up Dr. Sabat so he could just explain to the members of the body of just how much our COVID cases have gone down.
All right.
Dr. Sabat, Chief Medical Officer for the Health Department. There is some confusion, I think, over numbers. We have seen a trend downward. There certainly are still cases of positive cases, but the numbers have trended downward, and that's over the last couple of weeks. The positivity rate of 12% is, as Mr. Peterson suggested correctly, is because less are being tested. When you start to test more and the denominator comes back up again, you will see that positivity number drop. More importantly, and a number that I know the Assembly has been watching since the beginning of the pandemic, is a 14-day rolling average. That was somewhere in the 140s per 100,000. It is now down to 115.1 per 100,000. That has been steadily trending downward. If you look at your reproductive number, as of yesterday, I think it was 1.08 or 1.07. It's within 100th. That is trending down also. That was much higher. Back in August, that I think was around 1.36. Now, we are not out of a pandemic, but we are moving very close to that number of 1.0, which makes it an endemic. Okay, so all of the numbers look good. Now, if you want to talk about the masking again, which we have talked about quite a bit, I would remind you all that the Anchorage School District has a mask mandate for their students. The kids were here complaining about it, so we all know about that. However, what you probably don't realize, as of yesterday's numbers, their active case count was 448 as opposed to our 181, and their total cases are over 2,800. Now, that's a mix between students and faculty. They don't break that down. So I'm not quite sure that the masks are actually helping, at least where the school is concerned. If you have listened to all of the studies, you will know that what I'm holding is a medical mask, surgical mask. It's good for about maybe 10%, upward to 30%, depending on what studies you look at. I will tell you that the FDA will not approve any medication or vaccination based on 30% efficacy. You get laughed out of the room. That's what you're talking about mandating here. Now, I'm wearing one because I'm okay with 10% in this room. It's better than nothing. But I have a few risk factors. I am vaccinated, but as a courtesy to the Assembly, because you requested we wear masks, I'm wearing one. I don't need a mandate to tell me to wear a mask. Now, I'm getting a little bit off topic, but the point is that we have trended downward for almost a month now without a mask mandate. If you speak, as I said earlier tonight, if you speak to the state epidemiologist, Dr. McLaughlin, he is cautiously optimistic that our numbers are trending downward. So at this point in time, the numbers are good. They are not going up percentage-wise. So we are trending downward. Now, I know that we have been told we have one of the highest rates in the country. What you haven't been told, though, is we are in the bottom third for mortality, which is a tribute to our healthcare workers who have been improperly chastised time and again. Under very difficult conditions, they are doing a very good job. The state has a daily meeting of all the hospitals to ask, how are you doing? What do you need? Since they have had the staffing brought back up again, we hear very little in terms of problems. Sure, there are some episodes here and there where there are staffing issues, but it's not what it used to be, and there are more beds open than ever before. Whether that's going to continue or not remains to be seen. But right now, the numbers are trending in the right direction.
Thank you, Mr. Savitt.
Okay.
In the queue now we have Ms. Savitt.
Mr. Chair, can I please do a follow-up?
Sure. Yes, you still have some time left.
Yeah, it's for Joe, our health director, please. And I also wanted to state before Joe spoke that we are ranked 47th in the country for mortality rates, and that we are not under an emergency order with our state, with our governor, nor are we in our municipality. But I would really like to hear from our health director to hear his input on this, please.
Mr. Drace, recognized.
Good evening. Thank you through the chair again. I have some data that Dr. Savitt was referring to earlier, so we can just take, if you'd like, I could take 4 rolling Mondays for the last 4 weeks and address it. So yesterday's count was 181 for Anchorage. When you read the report, this question comes up. I want to address it. It comes in regularly to the health department. They break Anchorage into 4 territories. So you can't just look at that top line number. If you looked at this report, it would say 161. They break us into 4 areas. A week ago, the number was 272, same day, so the testing was the same. Before that, the number was 247, and then before that, 4 weeks ago, day specific, it was 1,002. So, I mean, we're talking about a pretty significant reduction in the number of positives. Also, I'd like to talk about what Dr. Savitt referred to, which is as we reduce the amount of people we're testing, not in a way to change numbers, but we've asked people that are symptomatic to test, the percentage of positives are going to go up. Does that mean the percentage of hospitalized people are going up? It does not. So I just want to note that as we've asked people that are not symptomatic, whether that be for asymptomatic or surveillance testing, to kind of stay away, to focus on the folks that are sick to get those results back, we're going to see that rate climb up because we're asking sick people to test, not everybody. Pending any questions.
Thank you. Ms. Allen, any follow-up?
No, thank you. He hit it right on the nose.
Thank you very much. Next in the queue, Ms. Zalatel.
Thank you, Mr. Chair. I don't disagree that the numbers are going down, but this is an opportunity for the layering of strategies and mitigation measures for the next 60 days. Right now, some of those numbers are going down because people are staying home voluntarily, or people aren't coming here at all and spending their money. There are economic consequences to the high case counts. The fact that our hospitals are in crisis standards of care should not be taken lightly. I appreciate the reinforcements we have from the state contract, but operating under crisis standards of care with reinforcement and doing nothing more is irresponsible. If we layer these mitigations for the next 60 days, we will have the opportunity to really bring our case counts down, hopefully give our hospitals the relief that they deserve, and steady out to give our healthcare workers not just enough staff, but enough staff to take a break. They deserve a break. Now, this emergency ordinance does some things that I would like to point out. One, it's only good for 60 days. 2, if 2 of our 3 hospitals are no longer operating under crisis standards of care for 14 days, the emergency ordinance ends and masking goes away. Further, it exempts religious assemblies. Frankly, it exempts the mayor and his executive team. This is not about getting the mayor to wear a mask. This is about our community's health. It also provides exemptions for athletics while actively engaged, including gyms. We have heard the requests and the concerns about this. They have been taken into account with this ordinance. This is not something done lightly. It is done after a considerable amount of public input, but the time to act is now. We need...
You knew you were going to do it, and you're...
Security,
We're supposed to testify tomorrow. You're jumping
you've been warned,
today.
please. No, you get 2. You get 1 warning and you're removed on the second one. Thank you. Please.
Utilizing an emergency ordinance mechanism is completely appropriate in this moment.
Hold on. She doesn't have to leave. She's been warned. All right, Ms. Zalatel, please proceed.
Thank you. It fully recognizes,
Mrs. Zalatil, I'm sorry, you have the floor.
thank you. It fully recognizes and acknowledges that COVID is dynamic and it ebbs and flows, but we are still at case count levels where we were last winter. We are moving into the winter. So I ask the body for its support. I ask the community for its support to do it for your neighbor, do it for your family members, do it for the kids who cannot yet be vaccinated. Hopefully, we've hit the 60-day window, right? And we will be hearing about a kid's vaccination. I think the time is right to do it now, and I urge members' support. Thank you.
Thank you. Next in the queue, I have Mr. Presverdia.
Thank you, Mr. Chair. Just want to hit a few points.
Mr. Presverdia, before
Can you
you
hear me?
go, hold on. Ms. Allegroza, I would like to warn you, please. Go ahead, Mr. Presverdia.
Thank you. Just want to reinforce a few points. I first just want to make sure to react to Dr. Savitt. I really, as the chair of the Health Policy Committee and as somebody who's been involved in these conversations over the past 2 years now, I really want to encourage him to give us solely his medical advice and not his political advice. I'm concerned when those two things mix. I want to say that I want to encourage my colleagues to support this. I hear that the numbers are trending down, but the case counts are still extremely high. Our hospitals are still at crisis standard of care, and we need to take action now. This is a very reasonable approach, knowing that it's a 60-day period. It's a compromise, and as the previous speaker said, it is based on what we heard from the community. We heard from more than 200 people speaking to us in chambers. We've received more than 3,000 emails. We truly have listened to the community, and this emergency order is a reflection of that. I really want to encourage my colleagues to support this. I believe that it is an appropriate and reasonable approach to what's going on in our community, and I feel like that it's something we need to do now. Thank you, Mr. Chair.
Thank you. Next in the queue, I have Ms. Kennedy.
Mr. Chair, did you say Kennedy?
I did say Ms. Kennedy.
Okay, sorry, it's just hard to hear you sometimes. Thank you. Actually, I have a question, and that could either be for Dr. Savitt or for Director Gervais. Either one is fine with me, but I wanted to talk about Section 2. And that is the idea of using the criteria of having insufficient capacity in our hospitals to the extent that they have to invoke a crisis standards of care policy. And my question specifically is, we have heard hospitals say that they're going to do this. Maybe some have not. They have the policy in hand and available should they have to address some kind of a capacity issue. So my question is, do we really know where our hospitals currently stand? And I do ask that because I know I have a family member that went to MAP2 emergency last week and actually got seen right away. So I just have a question as to really what we know about the current invoking of crisis standards of care with our community hospitals.
Thank you, Ms. Kennedy. Mr. Gervais is here to answer.
This is a very difficult question to answer as the private enterprises, they provide us with the data that we ask. They don't give us all the data we ask for. So it's very difficult to answer this. I have not heard of anyone being denied care. I do know that the crisis levels of care trigger they do this all the time in hospitals where they'll prepare for something by declaring an emergency and it doesn't actually arrive. That could just be they hear about a plane crash or some kind of a school bus accident and they go into some kind of response mode. It doesn't mean they get anyone off the school bus. So the same thing here, they're in a mode that allows them to react dynamically, but we don't know that. I've heard of no cases where someone was denied entry or they told them to take a minor injury and go to a private provider. So I haven't seen any reports of anyone in the community being turned away for service. Thank you.
Thank you, Mr. Drace. And next in the queue, we have Mr. Dunbar.
Thank you, Mr. Chair. And just a couple of points.
Other people, hold on, Mr. Dunbar. Other people on the phone, please mute. Go ahead, Mr. Dunbar.
Thank you, Mr. Chair. So just a couple of points. I know that there is the argument that this isn't timely, that we shouldn't do this now because the emergency is supposedly subsiding. I think that that is mistaken. The right time to pass this ordinance was probably 4 weeks ago. And then maybe it was 2 weeks ago. But the administration opposed the mask mandate before the spike started. They opposed the mask mandate when we hit the top of the spike. And hopefully we're on the downward trend now, but we don't really know. We know that there have been some issues with backups in the data provided by the state that might have inflated the prior curve. We know that testing has been reduced, and I don't think there was any nefarious purpose there, but we know that that has led to fewer people testing positive, we believe. 12% positivity rate right now, which indicates that there's a lot of cases that aren't being caught and aren't being tested. And I'll say also, with regards to sort of turning on or off this mandate based on the hospitals, I think that's one way to do it, but you'll see there's also a subsection 2 within section 2. It says if there is no longer substantial or high community transmission per the CDC for 14 consecutive days, and this goes away. So if the administration is correct and we are on a downward slope, then hopefully this will end far sooner than 60 days because we will no longer be in that high or substantial transmission. But right now, our reproductive number, our R0, is greater than 1. We are seeing case rates that are much, much higher than not anything, but at some of the worst times of last year as well. And it was announced today that 10 people in Anchorage, 16 people statewide, 10 of them in Anchorage, died in recent days. And we also know that there are dozens of people on ventilators. So the idea that we're not in an emergency now, because the emergency was worse a couple of weeks ago, I think just doesn't hold water. And I'd say also, for the families that are struggling with this or will be struggling with this in the coming weeks, if the mask mandate can reduce transmission by whatever it is, 5 or 10 or 15%, and save some of those lives, that's why I think we need to act now. The last point I'll say is I do think that this is a stronger ordinance than the one that was introduced 2 weeks ago. It really takes into account a lot of the feedback that we received via email and in person. There is a religious exemption, for example. There is the athletics exemption, for example. It removes the provision with the private cause of action where people were reporting on each other. And so I appreciate the work the sponsors have done. We are still in an emergency, and I urge passage.
Next in the queue is Mr. Weddleton.
Well, thank you. I guess a lot's been said to describe this. I did not support masking mandates a couple of times when it came up last year, and my focus at that point was hospital capacity. And I said, the case rates and so on, it didn't trigger it for me. But when we hit maximum hospital capacity, it's not an issue of people not protecting themselves and so on, but this becomes an issue for everyone. And we've hit that. We have a problem. And there are people being denied care. We've heard from the hospital directors that they are in a crisis. They have the crisis standards of care in place, which is not a light thing for them to do. And I've talked to doctors. We've heard from them here. We've gotten emails from them. I've talked to several at length. And, a heart doctor said he's got a dozen people who he simply cannot do surgery on because he knows he's not sure he will have an ICU bed. So he is letting them just sit. And he says they are losing heart capacity daily. So this is a crisis. So, I appreciate the sponsors on this because they finally hit something that, basing it on, hospital capacity has been my trigger. And unfortunately, we are in a place where we have serious problems with hospital capacity. If the cases go down, that's also good. That's another trigger. And they typically correlate to more hospitalizations. So, I'm thrilled that they're going down, and I hope that continues. And I think the longest this goes would be 60 days. And I fully expect that we'll be out of it before then. Hospitals don't want to be in crisis of care, and they'll get rid of that when they can. This clarifies a lot of things that we heard in public testimony over many, many hours of testimony. It makes very clear that it's only for people over 5 years of age, presenters, musicians, and people communicating in an audience, so theaters and so on can continue. It's, if you can't wear a mask safely when you're working, you don't have to wear one. If you can't tolerate a face covering, then you don't have to wear one. And you don't need to prove it. The individual's or a guardian's statement that they are exempted is sufficient evidence. So it's super easy, just, if you can't wear one. This is gyms, fitness centers, we want people to be healthy. The previous mask mandates from last year and the one that was proposed earlier did not exempt those. And we want people in their gyms, we want them to get healthy. This is about health. It exempts churches, religious assemblies. And I like that this does not say the mayor's got to do it. He's opposed to it. Mayor and his executive team are exempt. The section that had created quite a bit of consternation appropriately about civic actions against your neighbors, that's not in here at all. It's virtually, the previous one that mentioned vaccination made people nervous, that's not in here at all. This is actually fairly simple. So this is one that I can support, and I hope it's for a very short time. A couple things, masks, should we use masks? Do they work? And that's hotly debated. But over time, we have seen the more recent studies do show that broadly they don't protect me, they protect others from my funk. In fact, we are, as humans, are petri dishes, and we just spew funk out, and we know that, and this can help limit it somewhat. And that's, I think Dr. Savitt said maybe 10%. Well, is that not much? Can you say it doesn't work at 10%? That's all we need. We just have to kind of get the edge off of these peaks. And that's, that 10% can do it if people rally together and just for a little while. And we work to lower the spread and restore hospital capacity. We have heard ample stories of people who are having trouble getting into hospitals. So it's unfortunate to be here, but we have a pandemic, we're getting through it, and this can help us get the edge off and get our hospital capacity. Thank you.
Thank you. Next in the queue, Ms. Quinn Davidson.
Thank you, Mr. Chair. I just want to thank Mr. Peterson and Ms. Salatel for their leadership on this. I've heard a lot of people stand up and say that they're not brave for doing this, and I think they are brave. They know that political costs that sometimes comes with making hard decisions that are made for the right reason, and I just want to say thank you to both of them. I have great respect for each of you. I'm going to support this emergency ordinance for a number of reasons. First, being health benefits to save lives. We know that wearing masks work. I want to remind everyone that Dr. Hennessy quoted a 19% decline in transmission due to mask wearing in Anchorage last winter. In our city, last winter, when we made that decision, we reduced COVID by 19%. That's huge. And I know that Dr. Savitt is impressed that we are moving down, but moving down from really, really, really bad numbers and high rates is not all that impressive. 14-day average, as he quoted tonight, of 115 out of 100,000. That's really high. The highest cases that I saw when I was acting mayor was around 120-something. So we were at 140-something, now we're at 115. It's still incredibly high. I mean, a test positivity rate of 12%, that's staggering. We were worried when it was above 5%. Not to mention that a reproductive number of 1.07 means that actually more cases
cases are growing. We're seeing more cases. That's what that number means. If it's over 1, cases are going up. If it's under 1, cases are going down. So we still are definitely in a situation where we need to worry. Number 2, I'm voting for this for the economy. This keeps employees safe so that businesses can keep operating.
Hold on,
and
Ms.
it keeps
Quinn-Davidson.
COVID numbers low.
Ms. Quinn-Davidson, security, I would like to ask this gentleman to leave, please. Thank you, Ms. Quinn-Davidson. You can continue while we address the actual disruption to this meeting.
Should I go ahead, Mr. Chair?
Please proceed.
Oh, okay, thank you. This mask ordinance will benefit the economy. You know, one thing that was really a good part of being acting mayor is getting to interact with a lot of economists. And I heard over and over again that the economy is directly tied to the pandemic. If you bring COVID cases down, your economic success will go up. And we see this, right? My friends, they're not going out to eat. I don't go to restaurants right now. People are reducing their economic activity in the community. That is not what we want to see. A mask mandate will help us get back there. The other thing I want to say is that this is this is the easiest, least restrictive step we can take. It doesn't cost anything except for buying a pack of masks. So this is the best sort of measure that government should take, which is low invasiveness but high effectiveness. I also just want to point out that, we did some surveys last winter, and it could have changed, but residents were overwhelmingly in support of mask mandates in general. So while we have had a few hundred people in chambers who clearly are not in support, I'll remind you that we stopped phone testimony after the first night, so we didn't get the benefit of those who wanted to call in. And my aide has been tracking the amount of emails we got, removing people who wrote in twice. As of today at 4:19 p.m., we had 2,399 emails in support of a mask mandate and 1,323 against. So that's 2,399 in support and 1,323 in against. So, 1,000 more in support than not. Finally, I'm voting yes on this ordinance because it is our job as Assembly members to protect public health and safety. That is why we are elected. It is our job to make hard decisions to protect the public, and that's what we're going to do with this ordinance. Thank you, Mr. Chair.
Thank you. Next, we're going to go back to the queue for the final and second time of testimony from members before we proceed to vote. Mrs. Allard, you're in the queue for your second time.
Oh, thank you, Chair. I appreciate it. So the first thing I want to say is that we have so many exemptions going on. If masks really work, we probably wouldn't have any exemptions. The other thing I wanted to say, and I'm sure the mayor is going to get a little peeved at me, but wow, you are actually exempting the mayor and you're not exempting the rest of the community. That is absolutely outrageous. To give any sort of favoritism in your emergency order because it makes people feel good is just outrageous. If masks really worked, then I would just say that members of the body wouldn't have gotten COVID while wearing a mask. It is not our job as a government official or our duty, and I would say duty over job, for us to tell the community what they should do. That is between them and their providers. So there's some sort of miscommunication there on how government actually works or some education. So persons of the body might need to review that. I would also ask if Joe could please come back up because I keep hearing the number of 12% being thrown out. Well, that's just completely inaccurate, and I would love for our health director to better explain that number, and also if he could hit on the numbers in July versus our peak right now, please.
Mr. Dreis, please.
So the 12% positivity rate is not a population ratio. That is the number of people tested that return a positive test. That's not reflective of the overall community's infection rate. So does that answer on that one?
Thank you.
Thank you.
Mrs. Allard.
Yes, thank you for the clarification. And can you also talk a little bit about our numbers in July, when those were versus what our numbers are currently, please?
Sure. Going back to July, we were in a downturn at the end of the summer. We were trending down. At the end of summer, right around July, going into August, we saw the peak start going back up, and so that's just the nature of the cases. Now, this is not an apples to apples comparison because we're talking about times that we're vaccinated versus unvaccinated, and there's a lot of different factors, a different variant, Delta variant, so it has a much different nature. So I want to make sure that we're comparing apples to apples as we move forward in these numbers and those sort of things. We want to be very precise with the data. I've heard a lot of numbers thrown around, but I really like to be dialed in. That's kind of my thing.
Thank you.
Thank you.
Further, Mrs. Allard?
Chair, if you don't mind, I just have one final comment.
Please.
One of the members had brought up Dr. Hennessy, and I challenged Dr. Hennessy on his graph and his numbers. And I will state that Dr. Hennessy's graph was actually incorrect. And when I challenged him on it, I brought up the fact that the numbers in September were going down without the mask, and only 21 COVID cases were positive in Anchorage municipality, where in the Valley, they were only 21 lower. And that's only positive cases. So it's clear that masks don't work. And that's not even the argument with me. The argument with me comes into we as government officials should never push our medical advice on anybody. This is up to the public. This is up to the community. I encourage you to vote no, and I feel this is going to have strong backlash, and I will also put on record, I will not comply. Thank you, Chair.
Thank you very much, Mrs. Allard. Next in the queue is Mr. Rivera.
Thank you, Mr. Chair. So a few things from me. First, I just want to say I agree with everything that Ms. Quinn Davidson stated, Mr. Weddleton stated, Mr. Dunbar, and others in support of this emergency ordinance. So I think rather than restate their arguments, which I think are very sound, very valid, I want to give a few different arguments, which is, I think it's really important that we move on from this discussion. We have spent an extraordinary amount of time hearing from the public on this discussion, talking to our community councils, and now we are debating amongst ourselves. There's a whole host of issues, some of which we've dealt with today, like testing and separation of powers, but there's a myriad of other issues like homelessness, which we're doing really good on with the facilitated process. We have to deal with the economic future of our city and the budget, which is looming. So I absolutely support this emergency ordinance and look forward to us voting soon. I also just want to note, because one of my colleagues brought this up regarding the mayor and his executive team and the reason that they're exempted, I don't see it as showing favoritism to the mayor and his team. I think this is a willingness to compromise and ensure that the co-equal branches of government are able to get their jobs done at these assembly meetings. So I appreciate the willingness of the sponsors of this emergency ordinance to see that, to recognize that, and to give the ability of the executive branch to be able to do their job. Thank you.
Thank you. Anyone else? And I'd add myself briefly to the queue just to say the second testifier after our initial, our appearance requests really resonated with me tonight. Her message was, despite all of our differences, we really need to figure out how we can move forward together. The last 2 weeks have been extraordinary. I recognize that there's a lot of pain and suffering in this community. And when this process started with hundreds of people in this room, I realized at that moment some of the people who came to testify were not going to survive. And in fact, we've heard a very sad story of an individual who was here the 2 Wednesdays ago, providing kind of participation in the group, who's now on a ventilator and may or may not make it. And this is not somebody who spent the last year supporting my positions on matters, but in fact has been somebody who spoke consistently against the issues that I support and believe in. But I don't believe any less of him, and my heart breaks when I think about the fact that someone was in this room 2 weeks ago and is probably going to die from this virus. The enemy is not your neighbor. The enemy is not us. The enemy is this virus. And the answer to this problem is to fight this virus together. So I speak to three groups of people. For those of you who are tasked to enforce this, businesses, people who own and operate facilities in the community, many of you reached out and asked me to support this. You begged me to. To you, I say, I pray that this process is gentle for you. As members of the public who have stated clearly they're not going to comply, show up at your door and need your services. And to those who reached out to us and said you oppose this, who are operating businesses that are going to be tasked to enforce this, I pray that you are gentle in your enforcement and your willingness to do what needs to be done. For those of you who have long spoken about supporting this mask mandate, and there are many of you, I beg you to be gentle with your neighbors when you see them not wearing masks, because you don't know the footsteps they're walking in. You just don't know.
Chair, I have a point of order.
No, not yet. This is my time. For those who intend not to comply, I ask you
Well, if you're talking about my friend, we have a problem, Chair. Because you are absolutely...
You are out of order.
And?
For those...
So are you.
...who intend to not comply, I also ask you to be gentle with this community. My message to us all is that we are a community and that we will get through this. And with that, members may proceed to vote. This vote will be a roll call.
Absolutely insane you're thinking to wish somebody dead and he's not on an intubator. You have no idea what you're talking about. You're a disgrace as a public official.
You are out of order, and I hope he recovers.
And you're a liar.
So we will now proceed to a vote. It will be a roll call vote, and I will call the roll. Mr. Weddleton, how do you vote?
Yes.
Mrs. Allard, how do you vote?
No, and I'm really glad Mr. Constant decides to use somebody's situation against them.
Mr.
How
Peterson,
irresponsible.
how do
You're
you
disgusting.
vote?
You are absolutely disgusting.
Mr. Peterson, how do you vote?
Yes.
Mr. Rivera, how do you vote?
Yes.
Mrs. Kennedy, how do you vote?
No.
Ms. LaFrance, how do you vote?
Yes.
Ms. Zalatel, how do you vote?
Yes.
Mr. Dunbar, how do you vote?
Yes.
Stop coughing on old people!
Can you please,
Don't listen!
security, please remove
We don't need
Mrs.
to
Clark.
go around meeting again, Constance.
Mr. Dunbar, can you please vote again more loudly?
Yes.
Mr. Perez Verdia, how do you vote?
Yes.
Miss Quinn Davidson, how do you vote?
Yes.
Mr. Constant, how do you vote?
Yes. On a vote of 9-2, the emergency ordinance has passed.
At this time, Mr. Chair,